Thank you for joining us for this news conference. With me today are Lincoln-Lancaster County Health Director Carrie Kernan, Bryan Health President and CEO Russ Gronwald, CHI Health St. Elizabeth President Tyler DeJong, and Dr. Luke Bossard, a licensed clinical psychologist with Behavioral, Pediatric, and Family Therapy Program, LLC. At the City of Lincoln, we are committed to leading our community toward a more successful, secure, and shared future. One important way we create this future is through strong public health partnerships that our Lincoln-Lancaster County Health Department leads in collaboration with a wide range of community stakeholders. This morning, I'm so proud to join with these stakeholders and our health team as together we publicly launch a new video series developed to support youth behavioral health in Lincoln and Lancaster County. We developed the new video series in response to the priorities identified in our Community Health Improvement Plan. Entitled 6 Pillars for Emotional Wellbeing, this new video series empowers parents, caretakers, and children to develop conversations and rhythms and daily routines that support emotional health. The series exemplifies how our health team's proactive collaboration with community partners supports our youth, strengthens our families, and provides opportunities for all to lead stable, healthy lives. I want to thank our dedicated community partners and our team at the Health Department for working together to develop the Community Health Improvement Plan and this video series so that we can deliver on our priority to promote the health and well-being of our community. And now, here to share more about the video series is Lincoln-Lancaster County Health Department Director Carrie Kernan. Director Kernan, thanks so much for your leadership.
Thank you, Mayor. So part of public health is what we build together, working collaboratively to create real change that leads to a healthier and safe community. One of the ways we do that is through the Community Health Improvement Plan. We develop and update the plan every 3 years through an action-oriented process where our community determines a set of shared priorities and aligns efforts to make the greatest impact. In our previous Community Health Improvement Plan, we identified youth behavioral health as a priority coming out of the pandemic with a focus on addressing anxiety, isolation, and depression. In our current plan, 2 of our 3 priorities address the mental health of the youth, families, and members of our community. Our department worked in partnership with both hospital systems and numerous partners to better understand emotional well-being in children and how we can provide information and resources that address a critical need for our families. Dr. Luke Bossard served as a consultant to the work group on this topic and provided a key framework that is both practical and approachable. 6 evidence-based elements that are core to emotional health include sleep, physical activity, nutrition and hydration, relational connectedness, mastery, and quieting. The 6 pillar videos are simple yet powerful and contain 3 sections: the problem, the causes, and the skills. The videos provide a context for caring adults to have conversations with children in their lives and help build habits that support emotional well-being into everyday life. The first pillar video we're releasing today focuses on sleep, and we'll give you a quick preview of that in a moment. Another video will be released later in June, then a new video will follow each month. These videos can be found at lincoln.ne.gov/6, the number, pillars. In these videos, you'll hear from local and national experts, partners, as well as parents. This is a resource created by our community for our community, and I want to thank everyone who participated, including those here with us today.
Thank you so much, Director Kernan. Dr. Luke Bossard, as you mentioned, is a licensed clinical psychologist with Behavioral, Pediatric, and Family Therapy, LLC here in Lincoln, and played a pivotal role in the creation of this new video series. Dr. Bossard, thank you so much for your commitment to addressing youth mental health. And please, we'd love to hear from you more about how you did this work.
Okay. Thank you, Mayor. I've been practicing as a clinical psychologist for nearly 2 decades, the last 12 in private practice here in Lincoln. Recent research has supported the notion most child adolescent therapists have experienced that we're in the midst of a youth mental health crisis. Mental health trends among adolescents in the United States show a concerning rise in diagnosed conditions since 2016, especially anxiety and depression. Therapists and other providers of care around the country have worked hard to stabilize the surge, but the need has been greater than the availability of resources. I suggested one of the best ways we could catch up or even get ahead of this crisis is to more intentionally improve the health and well-being of our children proactively. Research is clear. Children who engage in a healthy lifestyle, families who have implemented healthy habits of the household, create a buffer and protection from the development of mood disorders. This response is accessible by all, including outside of the therapy office, and the model for the 6 pillars for emotional well-being is evidence-based. When adolescents sleep well, eat well, engage in physical activities and rewarding hobbies, find quiet and engage in healthy relationships, we provide opportunities for resiliency building and built-in adaptive coping. The 6 pillars came about progressively as I recognized several aspects of lifestyle had significant impact on mental health status of the clients I serve in my practice. I started with the 3 most related to health, so getting good sleep, which, as you'll see in the video, is absolutely critical to focus, energy, and mood stability. The Mayo Clinic recommends 8 to 10 hours of sleep for teens between 13 and 18. So also eating and hydrating, which can properly fuel our body, results in feeling energized, improves brain function and mood. And then physical activity releases stress-busting endorphins and lowers the body's production of stress hormones. So our children and teens need an hour a day of moderate intensity exercise 5 to 6 days a week. I later added mastery activity because therapists know that engaging in personally rewarding hobbies reduces stress, and activity scheduling actually treats depression. Quieting was added because when our minds are disquiet, we ignore the need to pay attention to the present. Mindfulness-based approaches and meditation can significantly reduce the symptoms of stress, anxiety, depression, and addictions. And the 6th pillar, relational connectedness, acknowledges the importance of stable and supportive relationships in our kids' lives, which correlates with healthy choices, better mental and physical outcomes. Healthy social connections improve our ability to recover from anxiety and depression and reduces the risk of suicidal behaviors. It's my hope that our community will accept the challenge to implement resiliency-building rhythms that will improve the mental health of our children and teens, to get ahead of this crisis as a community and watch our children and teens thrive.
Well, thank you so much, Dr. Bossard, for all of your work on this and for what you do every day for the youth of our community. Well, to develop this new video series and the Community Health Improvement Plan, our team at the Health Department partners with local healthcare providers like Bryan Health. And here to share more about their role in the series and ongoing commitment to youth mental health is Bryan Health President and CEO, Russ Gronwald. Russ, thanks for coming back. We appreciate your leadership.
Thank you, Mayor, and good morning. This year, Bryan is celebrating 100 years of serving our city, state, and region. And in 1939, we became the first general hospital, at that time Lincoln General Hospital, in the nation to provide acute care mental health services to adults. And today we remain deeply committed to this legacy by providing both in- and outpatient mental health and substance abuse services, and a dedicated mental health emergency department, which is really uncommon in the healthcare field. And yet, despite all of these wonderful assets in our community, behavioral health remains one of the highest priorities identified in our community health needs assessment. And so for this reason, I'd like to thank all the partners represented here today. Behavioral health is a challenge that no one organization can solve alone, and we welcome everyone to the table. In our mental health emergency room today, approximately 1/3 of all patients evaluated for behavioral health crises are youth ages 5 through 18. And so this shows the need for continued community engagement in this area. And the 6 pillars addresses basic skills we can all benefit from, which we've spoken about: sleep, physical activity, nutrition and hydration, relational connection, mastery, and quieting. As a farm kid from Adams, Nebraska, these pillars were a part of our everyday fabric. And while we cannot recreate an Adams, Nebraska of the 1970s in a community the size of Lincoln, these foundational aspects are what we must aspire for our kids today. Success will require the highest degree of collaboration amongst providers, hospitals, schools, the health department, families, and the network of dedicated nonprofit organizations that come along our neighbors every day. The 6 Pillars Project is a tangible example of the deep relationships and commitment to collaboration we have here in Lincoln. And the skills encompassed in this program can be taught at an early age, practiced for a lifetime, building resiliency and connection. At Bryan Health, we remain committed to this work, and again, we applaud everyone here today for sharing in the commitment to the mental health of our youth and ensuring that kids and families across our community have the resources and skills they need to thrive. Mayor?
Thank you so much, Russ. We appreciate all that you're doing and for being alongside us this entire process. And together with Bryan Health, CHI St. Elizabeth has played an essential role in this video series, in our public health partnerships, and in the well-being of our community. So thank you so much for being here today. CHI Health St. Elizabeth President Tyler DeJong has been here for this, and for we're just grateful for the 135 years of service that the hospitals provide our community. So Tyler, would you like to come up and say a few words?
Thank you, Mayor. Well, our mission at St. Elizabeth's guides us to make the healing presence of God known in our world by improving the health of the people we serve, especially those who are vulnerable, while we advance social justice for all. This year, St. Elizabeth celebrated 135 years of healing and improving our Lincoln community. And we're excited for the innovation that our community care will bring to Lincoln over the next 135 years. St. Elizabeth's is proud to collaborate with our community partners to improve the health of our community inside and outside of our walls. The 6 Pillars Initiative, focusing on sleep, physical activity, nutrition and hydration, relational connectedness, mastery, and quieting, directly aligns with St. Elizabeth's mission to build a healthier future for all, inspired by faith, driven by innovation, empowered by our humanity. We believe that the basic elements of mental and physical well-being are critical to a highly functioning and healthy community, and our teams are committed to closing the gap in collaboration with our community health and wellness providers. Mental health, depression, and anxiety were identified as one of the top concerns of our Lincoln families and our community health needs assessment. Within our data, significant concerns exist within access to care, youth self-harm, suicide, and fitness. Our team at St. Elizabeth's and CHI Health take these community needs seriously, and we're actively working to have an impact through our direct care and support of our community partners. This year, CHI Health awarded Brave Bee Child Advocacy Center a $600,000 grant through our mission and ministry funds, driving awareness for support of adverse childhood experiences and trauma. And we're actively screening our patients within our clinics and hospitals to identify early signs of depression and self-harm. These are just 2 examples of the many initiatives CHI Health and St. Elizabeth's is focused on, connecting children and adults to the resources and support they need to thrive. While the elements of the 6 pillars may seem relatively simple, we know there are many real-life circumstances that prevent families from achieving success with these basic needs. CHI Health is committed to making the necessary investments in our teams and our community partners to ensure all of our families have access and support to building healthy habits for strong mental and physical wellness. We're honored to partner with the health department and our fellow healthcare providers to ensure our children and families are supported with access to great habits and great health care. Thank you, Mayor.
Thank you so much, Tyler. We can't do this work without our hospital system, so thank you so much for the work you do. All right, well, these new 6 Pillars for Emotional Well-Being video series will help provide a solid foundation for youth and families to build and maintain healthy habits, contributing to our efforts to make Lincoln the safest and healthiest capital city in America. And now, to close things out, we thought we'd take a sneak peek at the first video in this series, which highlights the importance of sleep.
There's no one that's alive on the earth today that can go without sleep. So we all need sleep. And oftentimes we underestimate the amount of sleep we need.
Well, one thing we know that's entirely underrated in today's world is a good night's sleep.
Some of these things like sleep or exercise or how much water you're drinking, they don't even come to mind. They feel too obvious, I think, to most people, where it's like it feels so obvious that it's actually not important.
I've practiced self-control, so I realize and I'm aware of what my body needs. Kids do not. They think it's the teacher, they think it's another student, but really it's your low frustration tolerance because you're lack of sleep.
I think that very few teenagers really even understand what adequate sleep is. When I tell them, we need to be shooting for 9 hours, they look at me like I'm crazy.
I don't know a lot of teenagers that are getting 9 to 10 hours of sleep.
I think that a huge percentage of teenagers are sleep deprived.
All right, well, we hope you will check out this video and the rest as they become available on our website at lincoln.ne.gov/6pillars. And with that, we would be happy to take any questions from the media. Any questions? All right. Yep.
What is the timeline for the release for all the videos?
Do you want to take that?
Sure. So we'll be releasing the sleep video today. We'll do the next video at the end of July, and then we'll do one a month up until I think the last one is November. So it'll give the community time to view them, process, make some hopefully healthy habit changes, and yeah.
Okay. Any other questions? All right.
Thank you.
Yeah, thank you, Director Kernan. Well, thanks so much once again for joining us for this news conference and to learn more about the incredible partnership that is driving this work forward as we address our community's shared priorities, especially the priority of youth behavioral health. Thank you.